Simply put, DME Hub can do home medical equipment ordering better. Let's review the current DME ordering process. The patient is seen and diagnosed by his or her doctor. Next, a care team member, typically a medical assistant or case manager, creates a new order and collects the appropriate documentation to justify medical necessity. Then, the order is given to the doctor to review and sign, and finally the order is provided to the supplier. In our experience, what traditionally happens is only approximately 25% of the orders that are provided to the supplier are accepted the first time around. This leads to a lot of rework, back and forth phone calls and faxes between the supplier, the care team member, and the doctor for just one order. DME Hub was launched to address this problem directly. The DME Hub e-prescribing platform also provides you with peace of mind by knowing where is the order, where are we in the process, did the supplier accept the order or was the order rejected, is all the documentation correct, is the patient going to receive the equipment. DME Hub provides one central place to get the answers to all of these questions. Finally, DME Hub provides a one-and-done experience that generates all the necessary prescription and CMN data upfront, so the prescriber only signs the order once. Let's go ahead and begin the demo. I'm going to log in as a care team member. Again, this is typically the case manager, discharge planner, or medical assistant who puts the order together for the prescriber to review and sign. You log into DME Hub by using your email address and a unique password. Placing orders in DME Hub is a 5-step process. The first step is to enter the patient information. There are 12 pieces of information required to complete this step. We will enter the patient's date of birth, last name, first name, sex, delivery address, including street, city, state, and zip code, and the patient's phone number. If the delivery address is the same as the billing address, we will note that by clicking Same as Delivery Address, and the information will auto-populate. Today, we will enter an order for a patient who has Medicare. We will enter the patient's Medicare Beneficiary Identifier, commonly referred to as the patient's MBI, and the system will tell us if it is in the correct format. Next, we will enter the prescriber information. All the practice location information and prescriber information is already loaded into the system. Once you select the location, we will start typing in the prescriber's name and select the appropriate prescriber from the drop-down. All the prescriber's information will auto-populate and will be checked against the PCOS registry. Finally, click and save Next to move to the next screen. Step 2 is the Encounter Details section. You will be asked why negative pressure wound therapy is needed in the home and how it is to be used. We will select negative pressure wound therapy from the Order Type drop-down menu. Next, we will choose what DME supplier we want to send the order to. Only the DME suppliers that provide negative pressure wound therapy will appear on the drop-down menu. DME Hub is an open network platform, and any DME supplier is welcome to join. DME Hub also gives the prescriber and the patient the ability to direct the order to a specific supplier, which helps to preserve doctor-patient choice. If this order is urgent, check the box and select the time frame from the drop-down menu. We will select yes, this order is urgent and is needed in a time frame of 3 to 4 hours. For the chief complaint, we will enter the face-to-face encounter date. We will enter the history of present illness details. You can enter up to 2 diagnoses for this patient, justifying the need for the therapy by entering the ICD-10 code or entering the diagnosis description. For this negative pressure order, we will enter L89.214, pressure ulcer of the right hip, stage 4, and L89.154, pressure ulcer of the sacral region, stage 4. Next, we will need to enter the total number of wounds requiring negative pressure therapy. We will enter 2. Next is a series of questions defining the wound size and conditions. For qualification, the wound length, width, and depth is required. We will enter a length of 5 centimeters, a width of 3.1 centimeters, and a depth of 0.7 centimeters. Notice, DME Hub will calculate the total wound surface area. This wound has a total surface area of 15.5 square centimeters. Next, we will identify if this wound is located on the patient's foot, sacrum, or abnormal curve of the body. This wound is located on the right lower hip, so we will click Yes. Next, we will identify if there are any special conditions for this wound. You can check any that apply. We will check bone and undermining. Some conditions, such as tunneling and undermining, will require additional details. For our example today, we will indicate there is undermining present, and we will enter a depth of 1.0 centimeters and a location of 3 o'clock. Lastly, we will identify if wound debridement of necrotic tissue was performed, and we will indicate yes. We will repeat these wound details for the second wound. Patient details will complete the pre-qualification requirements. Is the patient nutritionally compromised? We will select yes. Next, we will need to identify if the patient has a pressure, neuropathic, or venous ulcer requiring negative pressure wound therapy. By clicking yes, care team members can identify that all apply. For our patient, we will check pressure ulcer stage 3-4. Notice additional qualifying questions will populate. Has the patient been provided a group 2 or 3 support surface? If you select no, a coverage warning will appear. The coverage warnings will not prevent an order from being completed, but it will warn you that the product may not be covered because the group 2, group 3 support service has not been tried and failed. For this order, we will check yes. Next, we need to identify if the patient is incontinent. If we select yes, patient is incontinent without moisture managed, another coverage warning will appear, warning that coverage may likely be denied. We will select yes, patient is incontinent with moisture managed. The last qualifying question is, were the ulcers and wounds encountered in the inpatient setting? If we select yes, we would need to identify if the patient had complications of a surgically created wound or a traumatic wound. For our example, we will answer no. The plan of care will define how long the patient needs the equipment. We will select 4 months from the drop-down menu. The last part of the encounter details is the equipment and supplies. This patient is new to the wound therapy, so we will start by checking the dressing set. Select the dressing material, foam or gauze. Notice the blue reminder boxes to the right of the dressing size and dressing quantity. Based on the wound details entered above, there are recommendations to size up the dressing size due to where the wound is located. We will enter a dressing size of medium. The quantity recommendation is 30 dressings for 2 wounds, so we will enter a quantity of 30. Next, we will check the wound suction device. The setting will default based on the dressing material selected, but can be edited to whatever pressure is prescribed. Next, we will add the suction canisters. The guidelines for the patient is 10 canisters per month. This is a quantity recommendation based on the insurance guidelines. Any number can be entered. We will enter a quantity of 20 because there are 2 wounds. Since there is more than 1 wound, we will check the Y connector option. That completes the encounter details. Click Save and Next to move to the next screen. In Step 3, the suggested negative pressure wound therapy equipment will be listed based on the way you answered the encounter details questions. Next, click Accept Recommended Selections to move to the next section. In step 4, you'll be presented with a checklist of the items that you are required to include as supporting documentation for a negative pressure wound therapy order. DME suppliers will always accept any general encounter notes which can contain observations, symptoms, physical assessments, and diagnoses. For negative pressure, the face-to-face notes also need to include how a moist wound environment is maintained, including the dressings applied and frequency of change. These notes should also include how a nutritionally compromised patient is to have their nutritional needs met. Face-to-face notes should also include details for turning and positioning for patients with stage 3 and 4 and which specialized support surfaces are to be used. Medicare requires that a Group 2 or 3 support surface has been tried and deemed clinically ineffective. Once you have determined that all the items in the checklist are in your supporting documentation, you have 2 ways to get that documentation to the DME supplier. You can attach a document just like you do with an email attachment by clicking on the upload box. You also have the option to copy and paste the supporting documentation directly from the electronic health record. Navigate to the encounter note in the EHR. Next, click within the note and highlight the text you want to copy. Then simply paste the text into the text box and create a title for the document. DME Hub will take what you copied and pasted and generate a PDF that will be attached to the order. It will include any charts and graphs that were in the original note, as well as the electronic signature. Finally, click Save and Next to move to the next screen.
The final step is to review the order. Notice there is a reminder that this order will require a prescriber signature to complete. You can include notes to the supplier. Review the negative pressure wound therapy items that have been ordered, the supporting documentation that was attached, and the patient information. DME Hub will generate the detailed written order. There are 3 ways to sign orders in DME Hub. If the prescriber prefers to sign on paper, you can click on Print to Sign and have the prescriber sign and date the paper copy, and then scan the signed documents into DME Hub and attach them to the order so they can be sent to the DME supplier. Prescribers can electronically sign by using a computer or on the DME Hub Review and Sign mobile app. When you click Send for e-signature, the prescriber will receive either an email or text message notification that an order is ready to be signed. Notice that there is no protected health information in the prescriber notifications. The email or text message notifications only contain the type of order to be signed and the DME Hub order ID. There are 2 ways to electronically sign orders in DME Hub. I am going to log in as a prescriber. This is someone who has an NPI number and will review and sign the order. Notice that my landing screen automatically defaults to the unsigned queue. Click Review for the order and it will open. The prescriber can scroll down to review the delivery date and has the option to add any additional supplier notes. The prescriber can also review the equipment and settings for accuracy. The detailed written order is available for review. Scroll to the bottom of the order and click Sign Now. That action will send the order to the selected supplier to be qualified and delivered. DME Hub has a Review and Sign mobile app for iOS and Android devices that can be downloaded from the Apple App Store or the Google Play Store. From your mobile device, log into the app. The order queue will open. Touch the order you want to review and sign. Scroll down the order to review all of the details. Scroll to the bottom and click Sign Now. The app will automatically take you back to the order queue. As orders are signed, they will be removed from the mobile app queue. Since many prescribers work in multiple facilities,
The DME Hub mobile app allows them to sign orders when they are off-site. When an order has been qualified and accepted, an email notification will be sent to the care team member and/or prescriber. Finally, when the equipment has been delivered, an email notification will be sent and all delivery details can be reviewed on the order. That brings us to the end of this demonstration. For additional information and video content, please visit dmehub.com.